Hi, I'm Kash Akhtar. I'm a consultant orthopaedic knee surgeon. I specialise in sports-related knee injuries. I'm here at Hammer Hempstead Snow Centre and we're here to talk about skiing injuries. Skiing is a wonderful workout for the body and the mind. From the body, it's a great strength workout, it's cardio and there's balance. From a mental point of view, you get an endorphin release, it's exhilarating, it's often social, and so there's huge mental health values as well from skiing. But the thing we'll be careful about is that the thrill of the speed and the unpredictability of the slopes means that falls do happen and injuries can be quite significant. It's important that people are prepared for skiing, they're optimised, they have the right equipment, the proper technique, and they know what to do if they get injured. Prior to skiing, there are a few things that you can do. There's the preconditioning. That is working out in the gym and being ready before you go, and maybe working with a physiotherapist or a personal trainer if you have an injury prior. But it involves things such as strengthening, core strengthening, strengthening your legs, and being prepared from that point of view. Having the right equipment is key. You've got to make sure that you've got the right boots and the right bindings and they're fitted appropriately for you. It's really important that you ski smart. By skiing smart, I mean sticking to the runs that are suitable to your level, having appropriate rests in between. And the big worry is that one last run when you're fatigued, that's when accidents happen. If you have a skiing injury and you find that you can't bear weight, that your knee has swollen up and you're feeling unsteady, or your knee is locking or giving way, then you should stop. If you feel safe and comfortable and you can ski off the mountain, do so and look for medical help. If you can get safely to a chairlift and get off the mountain, that's fine. But if you can't, you should stay put and wait for the ski patrol. They're trained to assess you and get you safely off the mountain. Once you're off the mountain, the first thing to do is just to take a step back and just let things settle. If you're in pain, you take painkillers and anti-inflammatories. If you've got a swollen joint, be it an ankle, a knee, a shoulder, an elbow, you would rest it, you would ice it, and you would take anti-inflammatories. If it calms down and you feel okay, then good. But if you have any concerns or you're struggling to perform activities or to walk, then I'd strongly recommend going to a local medical centre. All ski resorts have medical centres where they can take x-rays, they can assess you and examine you, they can provide you with painkillers, braces, crutches or splints to help you. I think as soon as you're home, the key thing is to get an early diagnosis. There are quite a few injuries that can be quite time sensitive with regards to the recovery and the outcome. So the earlier you know what's going on, the earlier you can treat it appropriately. Coming to a place like OSD Healthcare is really vital. We have doctors available in all specialties. You can get an x-ray, an ultrasound or an MRI. You can get an injection or have fluid taken off the joint. But knowing exactly what is wrong is the key to getting early treatment. And then we have physiotherapy here if you need rehabilitation. But if you needed braces or orthotics or other interventions, they are also available. Skiing is exhilarating and it's a wonderful pursuit. It is really important to stay safe. So my advice is be as strong and prepared as you can before. Make sure you have the appropriate equipment and the right technique. If you have an injury, stop, take the load off and get local assessment should you need. And as soon as you're back, I'd recommend coming to a place like One Stop Healthcare and getting an early diagnosis so you know exactly what is wrong, so it can be treated in the most appropriate way so you can have the quickest, safest return to full activity.